Imagine this. You are having some extreme headaches. It's been going on for a while now, and so finally you go to visit the doctor. While there, the doctor looks you over, makes an assessment, and then goes off for a minute before returning with a large drill. The doctor asks you to lie back, says, "Get comfortable, this might hurt a little bit," then presses that drill up against your head and drills a hole in your scalp. Now, what you just heard about doesn't sound like any kind of medical practice we do today, but it was done for hundreds, if not thousands of years. It's called trepanation. Now, we don't practice this anymore. Instead, we do things like MRIs and CAT scans, and we take specific drugs to help relieve those headaches. So how did we get from a practice of drilling holes in people's heads to what we have today? Let's start with ancient cultures and the belief in animism. Animism is the belief that everything from living creatures to inanimate objects has a soul imbued, and souls can affect each other. If you have a larger, stronger, more significant soul, that affects the smaller souls. So when things happen in our environment, it's because the souls are interacting and deciding that that is the important thing to do. So when a volcano explodes, or lightning strikes, or a great flood conquers and wipes out civilization as we know it, it's not because of just random nature. It's because of gods and because of these spirits. And if the spirit can affect the environment, the spirit can also affect your body. Back in ancient culture, if you were sick or ill, it wasn't because of a disease or a bacteria, it was because of these spirits. And this was the prevailing thought for many thousands of years, many ancient cultures. But then we started to see a growth of philosophy. And philosophy was in many cultures. We see it in ancient Babylon, we see it in China, we see it in ancient India. But we from Western medicine are going to focus primarily on the philosophies of Greece. And when it comes to medicine, we're going to focus on one particular Greek philosopher, and that's Hippocrates. Hippocrates is the father of medicine. This is because during his day, medicine was treated as a mystic, supernatural kind of belief. Again, gods are affecting our health. But he didn't buy this. He thought, if the gods are in fact in charge of our health, then we should be able to see what did people do to upset the gods, and what effect are the gods' ire having? How long will it last? How will it manifest? And so he set out to collect data. He was by the patient's bedside collecting information about what was happening to their body and what had they done. And from this he determined it wasn't so much about what they had done to the gods, but it was about what they had chosen to do in their lifestyle. He found out that diet and our way of living, like exercise and the kind of housing we lived in, those were what played the biggest role in health, not who we worshipped. And so he said that the environment is in fact what is determining our health. And if we can look at this data and determine that the environment is determining our health, then we can actually change our behavior. We can change the future of our health. So we came up with the idea of prognosis. This was looking at the signs and symptoms as well as somebody's lifestyle and determining what the course of their sickness would be. If you have this kind of cough, how likely is it that you are going to survive it? How likely is it going to get worse? And if you change what you eat, then will it get better faster? Hippocrates also believed that a lot of the mystical beliefs that were being passed around to heal people weren't having a positive effect. There was no data to prove that they actually worked. And so he said, most of what you're doing is actually bad. You're giving bad advice and you're hurting people more than you would have if you just left them alone. And the only reason we should be affecting people is if we know it will help. So he came up with the idea that unless we know it works, don't do it. Do no harm. And this is the fundamental core of the Hippocratic Oath, which our doctors today have to take. Now, Hippocrates wasn't just famous for prognosis and the Hippocratic Oath. He also developed what we know today of as the humoral theory of imbalance. You may have heard of the yellow bile, black bile, blood, and phlegm. These four humors occupy our body. They make up our entire system. And it's really interesting how they came to this conclusion. It was actually by bloodletting and seeing how blood coagulates. You'll see that as you let it sit for about 72 hours, it starts to form different layers. And they saw that some of those layers were more than the others. And if you were sick, could that be correlated? They started to deduce that if you had more of one thing, then you would act one way, and if you had less of another, you would act a different way. And they determined there was a perfect balance of these four humors. And so if you were imbalanced, you needed to repair that balance. And here we are back at bloodletting. Here we are at vomiting and diuretics, ways to improve that balance. Now, this became wildly popular and again started what we now know of as Western medicine. And it was picked up later by Galen. Galen took these ideas of the humors and he ran with it, but he had an advantage. He knew a lot about anatomy. He did a lot of dissecting animals, working with gladiators who were injured. Maybe they made it, maybe they didn't. But he worked with them to understand what was actually going on inside our body, not just externally. So by looking inside, they figured out that the body worked in certain ways. And so they could start to not only prognosticate of looking at somebody and determining the future, but they could start looking at all of the symptoms someone was experiencing and start to diagnose them. They could look at the combination of these symptoms and say exactly what the person was experiencing, which they couldn't have done beforehand. Again, they didn't have all the information. So Galen pushing this humoral theory and this idea of diagnosis really pushed medical science